fiber tape grasper here.
It might be in that other pin at the end there.
Okay. This one right here?
No,
Right here.
these are the people.
Oh, yes. Okay. Good. So this one grabs fiber tape, which we will most likely use on a rotator cuff repair. Okay. This one grabs suture. Okay, and I'll call them that. Give me the suture grasper or grabber, and give me the fiber tape grabber. Okay. You don't need to have those up on this thing. They can be back. They're sitting in the front right here. Okay. We have two different types of suture cutters. This fiber wire is really tough stuff, so you need a special cutter to cut it. Okay. This is the open-ended cutter, and this allows me to cut it flush. Okay. The other, the closed-ended cutter, do we have that here? No. Well, we need to find that. Here.
Is it in the bottom of that white tray?
Don't write that down.
No. Is there anything else in there? No. Right there. Look. Just close to that.
So we need to write that down. You need two suture cutters on each case. The open end and the closed end. The closed end will leave a nice little tag. Okay, so if I'm tying something, I want to keep it tied. I don't want the knot to come out. I want to use that closed-ended cutter. And that can be kept right here. So if we're going to fix a rotator cuff, now we're going to move from inside the shoulder joint into the subacromial space. I'm going to take the arthroscope out of that posterior portal. I'm going to put it in the posterolateral portal. Okay? And I'm going to, if I haven't already, make an anterior lateral portal. And when I make those changes, we'll take the camera out of the sheath. We'll put the obturator back into the arthroscopic sheath. And then again, we're going to use this little guide, again, help make our portal. And you'll see I'll put them both at the same time, and I do that so I can touch the ends and know that when I put my scope in, I'm going to be able to see this thing. Okay? Usually the patients have lots of bursitis or inflammation tissue, so trying to find myself and then make a space is the next move. I'll take this out, put the scope in, and then we'll undo this. And usually we just go right in with the shaver and I start to shave the bursa out. Okay? If we're doing a rotator cuff repair, there's going to be bleeding, and so we want to use an ablator. Okay? So for rotator cuff repairs where there's going to be bleeding in the subacromial space, I like the toothbrush because it's the biggest, most powerful one. It just gets rid of the tissue quickly.
You want that open on all rotator cuffs?
You know what? Yes. Yeah. If we're doing like a shoulder instability, you know, a labral repair or something, don't open an ablator. But if I do want an ablator on that case, I'm going to take the smaller one, okay, and it's called the cool cut, okay, and you need to get that if we don't have it. And the reason why I use it is that it's not as powerful. If I'm like ablating synovium within the shoulder joint, I want to use less power because I don't want to injure that articular cartilage. It's usually going to be a younger patient, no arthritis. Last thing I want to do is ablate their articular cartilage. And so I'll go slower, there's not as much stuff to take out. Okay? So we're in the subacromial space. I'm doing an excision of the bursa. I'm also going to use the ablator to incise the coracoacromial ligament. Okay? And we're going to trim up the edges of the rotator cuff. And now we need to repair that rotator cuff back down to the bone. Okay, we're going to prepare the bone by cleaning off any of the scar tissue or remnants of the rotator cuff. To do that, I use a curette. Okay, and we have these special curettes. The little one is called the ring curette, and this one is called the D curette. I guess it looks like a D if you do this. This one's more aggressive, and it's usually the one that I use. Okay, and then I'll use the shaver to help clean up some of the tissue. And on occasion, I will use these rasps also to rough up that bone where I'm going to put that rotator cuff back down. Now, they made these two rasps. They're different, but they got the same color handle. So now we got to give them a name. Okay. So I call them the rasp toward me, because this one faces towards the handle, and this one is the rasp away. Anybody have a better idea? Fine, but they made it the same color. So now I'll say, give me the rasp towards me. Give me the rasp away. And that's what it means. Okay? I use these more often though when I'm doing a labral repair. So now we've prepared the bone, we've got the tendon, we're gonna put it down to the bone. We're gonna either use anchors, and most common anchor for rotator cuff repair, if I just want an anchor, is going to be the 5.5 bio corkscrew. Okay? So in order to make the hole for that bio corkscrew, we use one of these things right here. We used to have a tap. It was a green handle.
Do you want me to get it?
Yeah, this is for the...
Hang on.
You know...
Just a second, I'll get the...
This is for the swivel lock.
About crash down.
Anyway, so we're going to repair the rotator cuff. I'll make a pilot hole with, if it's going to be a 5.5 bio corkscrew, I'll make a pilot hole with this. We might have a tap, a self-cutting tap, and then we'll put the anchor in, and now we got to pass the suture. To pass suture, I use one of two methods. Either I poke a hole through the tissue and grab the suture with one of these things. This is called a penetrator, and this one is broken. Guys, see it's bent? Who's keeping a list?
What is it now?
We need a penetrator. This one's broken. No, see, it should be straight. See how it's off to the left.
Okay, I'll just make that.
No, you know what? I think I did this. I'm not going to lie here. I think I did this. But it's old. I mean, this thing has been here for more than a decade. So this is called the penetrator, and these are called the bird beaks. So sometimes, you know, if it's a subscap repair, I'm going to put in one 5.5 bio corkscrew, okay? And then through the front portal, I'm going to put in either a bird beak or a penetrator, push it through that rotator cuff tendon, grab the suture, pull it out, make another poke hole, grab the suture, pull it out. Now we have two sutures, tissue in between. I can tie a knot. Okay, it's just a mattress suture. Okay, and that's what I use these for. On occasion, if I'm repairing the top rotator cuff tendon, I'll use these too. But most of the time, if I'm repairing the top rotator cuff tendon, we're going to use the scorpion. Okay. So we're going to put two anchors in right along the edge of the joint, the ball. Okay. And they're going to be these 4.75 swivel locks, and they come loaded with 2 pieces of tape and suture. Okay, and actually 2 strands of suture. Make a poke hole. It does have a tap. If it's hard bone, I use the tap. If it's soft bone, I just push this thing in. Okay, and then I will bring all of the suture, grabbing it with that tape grabber out through the front side portal, okay? And then we'll load them all together. We can do that at some other time when we have the thing open, all on this, and I'll put it in, I'll grab the rotator cuff, one arm of the suture goes through and it pulls all those other tapes and sutures with it, okay? And we usually use 2 of those swivel locks with the tapes and the sutures, okay? Once we have those in, we get one from each, and I don't have anything to write on, but we get one from the front.
Here you go.
Okay. This side?
Either side.
Either side? So, swivel lock here, swivel lock here. Here's the edge of our tendon. We're going to pass. Okay, so all of the tapes that come on one of those swivel locks are coming out through this hole. Usually 2 tapes, okay, and then 1 suture that actually can slide back and forth, but you're going to see 2 strands of it out here. Okay, we're going to take 1 tape from the front, 1 tape from the back. And usually I'll do the front one first. Okay, and then we'll pull on them. Okay, we'll make another hole here for another 4.75 swivel lock. Okay, and we'll load those tapes onto the end of that swivel lock. It'll come up without any suture on it. We make a hole, slide the tapes through there, put it into the hole, and so the tapes are going into the hole. The way these things work is this. You have this inserting device, and it has a tip on it with a hole. Okay, and if you put the sutures through here, it'll pull the sutures down into the hole. Okay, and then it has a screw on it. And if you put that screw in there, it's holding the sutures in the hole. That's how it fixes these things. Okay, so we'll cross one from each front and back, nail it down in the front, and then we'll do the same thing over here. Okay, and that's a basic construct. And this is called a double row repair. And this is also called, it comes in a kit called the fast bridge, or speed bridge, okay? And I have all 4 anchors. 2 of the anchors are loaded with the tapes and the sutures.
And
Okay?
the reps always bring those, correct?
I don't know.
We don't have those types.
Right, yeah, Tyson brings that stuff.
So now we have all of our tapes are put where they need to be. We've got 2 sutures here. What I'll usually do is I'll grab 1 arm of each suture. I'll bring it out through the portal. Okay, we'll shorten them up. I'll tie a knot in it, cut off the end, pull it back in so that that knot's either in the front or the back. Pull the other ends of the sutures out and then tie them over here. And so what that gives us is it gives us this kind of a repair. Okay? And I like this suture over here because it's right at the articular margin. So here's our rotator cuff tendon. We've got 2 ankles here. Okay? And then we're going to have a suture going from front to back here that's pushing down right at the edge of the articular margin. And then we have our tapes coming across over here. And it's kind of like a tarp, you know, if you put a tarp on your car carrier and you put the bungee cords on top of it, it's pushing that whole rotator cuff tendon down onto this bare bone. Okay? The one thing I didn't mention is that we have a different cannula that I usually use on a rotator cuff repair, and it's called the Passport. Okay? And I usually put that in the anterior lateral portal. And it's just a lot bigger, and it's shorter so that when the real benefit is that using this scorpion through one of those plastic portals, or plastic cannulas, can't open the jaw. So that Passport allows me to open the jaw because it's that soft silicone. Okay, so even if this is still in that thing, it'll push it open. Plus, it's a little bit bigger. So usually, if I open a Passport cannula, it's almost always a 3. Unless it's a real little lady, it's a 2. If it's a bigger guy or a bigger lady, it's a 4. But almost always, it's a 3. So we need Passport cannulas when we do rotator cuff repairs. Okay.
How do you measure what size it is? Is there
You know, there is an instrument over here. Do we have it?
Yeah, I think so.
This thing right here. You can put this through the portal, and there's markings on it where it comes off. On the outside of the skin, it's marked, you know, 2, 3, 4. But these days, guys, I've been doing it so long, I just say, I'll tell you. You know, sometimes I'll use this. Where this is really instrumental is if we put that cannula in. I have to teach each one of you how to mount it on a hemostat to put it in. Okay? When you put it in, sometimes the side that's inside the patient is all folded up. And it's supposed to kind of open up like this and fit up against that deltoid muscle so it's out of the way. And this is really good to kind of put in. You can put it in like this, flick it, and then just turn it around and it'll flip back. Okay? If I have to tie knots, this is the knot pusher I use. Okay? Oh, there you go. So if we're going to do a Bankart repair, that's a labrum repair inside the shoulder joint. I'm going to use a posterior portal, an anterior portal, and then I'm going to make a what we call an anterior superior portal. Okay? Purple in the front, almost always. Yellow in the anterior superior portal, always. Okay? And now we've got to repair the labrum. The instruments that I'll use for that the labrum is usually scarred down on the neck, and so the first thing you have to do is mobilize it. And these are called arthroscopic elevators. Less angled, more angled. That's how I call for them. Okay? And I almost always use this first and this last. And I'll just scrape that labrum and capsule right off the edge of the glenoid. Okay? And I also use these to kind of rip any scar tissue so that I can pull that labrum back up on top of the face of the glenoid. Okay? Once I have it mobilized, the next thing I want to do is I want to clean the neck of the glenoid down to the bare bone. And I'll use the curettes, I'll use the rasps, and I'll use the shaver.
And what shaver? Your aggressive plus?
Yeah, same shaver. Pretty much that's, you know, it's less, you know, that's all money on our, you know, on our shelves over there. So over the years, I can do just about everything with that. Okay? So we'll scrape up the neck of the glenoid, okay, and then we're going to put anchors in. And we do things a little bit different. We put these anchors in. They're smaller anchors. Right now what I'm using is I'm using a 2.9 push lock, and I'm using a fiber link. So we've got to get the suture around the labrum, and then we have to get the suture fixated into the bone. Okay? So to pass the suture into the labrum or around the labrum, most common thing that I'll use is the suture lassos. We don't keep those here. And again, we'll just have the reps bring them in. And you'll hear me say when we do it, I want a 45 left or a 45 right. Okay, or a 25 tight right or left. And you just let the reps worry about that. And they can open them or give them to you to open them. Okay? And then usually we'll pass that through the labral tissue. I'll use my suture grabber to grab the little nitinol wire that comes through there. We'll pull it out of a portal. We'll put a suture in there. We'll pass it through. Okay? There are other anchors that we use. I think we have 3.0 suture tacks. We keep those here. Okay? When we use those, we're going to use this system right here. And there is a drill that comes with this. Oh no, there's not a... Is there a drill?
I don't think so.
Or is it just this tap? It must just be this tap.
I don't
So
think
we've got
it's any drill, just the tabs.
the older fashion. So we'll put use one of these guides, put it up against the bone of the glenoid. This taps a little starter hole into it, and then this is used through there to tap a hole, and then the anchor comes in a package, long arm on it, put it in, turn it in, and now you got the anchor in the bone, the suture coming out of it, and we can then pass the suture through the labrum, and then I'll tie it up. So that's how we do a labor repair. Burrs, I almost always use one burr for shoulders, 5.5, what do they call it, barrel burr. Okay? On occasion, small person, little bone, I use a 4.0. And I use this burr to do everything that I need a burr for. I'll do the acromioplasty, so I shave underneath the acromion, and if I'm going to take the distal clavicle out, same burr. Think of anything else. Other pans that we use, let's say we do a biceps tenodesis, okay? That means I'm going to fix the I'm going to cut the biceps tendon where it attaches on the top of the shoulder on the labrum, and I'm going to put it into the bone at the bottom of the bicipital groove on the humerus, okay? So I'll cut the tendon, I'll make that bicipital portal, we'll pull the tendon out, okay? I'll need a number 2 fiber wire, and I'll do a whip stitch on the tendon. I'll cut a little piece of the tendon off, do a whip stitch on it, okay? And then we'll need the actual set, the biotenodesis set. And that has a handle, okay? And you'll need to thread a number 2 fiber wire through the cannulated handle. You'll put the screw onto the screwdriver. You'll thread a number 2 fiber wire, okay?
Additional to the one you put the stitch in?
In addition to it,
okay.
Yes. So maybe get the board over here again.
No, that's...
The other side. Okay. So there'll be a little bit of the tendon coming out of this little portal, okay? And I'll do this whip stitch. And this is number 2 fiber wire. How it really looks here, but it's got this little wing on it, okay? And then it has a long, thin thing, and this is hexagonal, okay? So if you look at it, it's like that. And you're going to put the screw on, and we'll tell you what size screw it is. And then there's a nitinol wire that you'll pass through here, and you use that to pass a number 2 fiber wire. And so there's going to be a loop of fiber wire with 2 ends coming out here. Okay? And then what we're going to do is we'll take these sutures, put them through this loop. So eventually what I want to do is I want to lasso the tip of that tendon with this thing. So the screw's on here, okay? So now, and I'll pull these sutures tight, and we either snap it with a snap, or there's a thing you can loop it on. And now I'm going to take this whole thing, and in the bone I've drilled a socket. I'm going to put this whole thing in, okay? And again, it's pulling the tendon in. And I've got this screw, okay? And I'll hold on to this, and when I screw, it pushes the screw in. So we're going to wind up with a tendon in a socket, okay, with a screw. Okay, we're going to have some sutures that are outside of the screw and some sutures going into the screw, and then I'll tie a knot in these to kind of back up the screw fixation. And so anytime I do a tenodesis, okay, that's what we do. And that's a separate set. And usually they'll bring the set with them with the screws. And it's almost always a 6.25 by 15 millimeter screw. And the drills are those little acorn drills. And I'm almost always drilling a 6.5 drill hole. Okay? If we do a biceps tenodesis, some patients, the tendon's so beat up in here in the shoulder, I have to actually do the tenodesis down here below their pec tendon. We'll make an 1.5 inch hole, okay, incision. We'll need Army and Navy's, okay. I'll find the tendon down there, I'll pull it through, cut more off, same whip stitch, same anchor, same drill, same screw. Okay, except we're going to do it down here below the pec tendon. It's called subpectoralis biceps tenodesis. And then, that's done non-arthroscopically. So I'll just leave the scope in the shoulder, and then we'll kind of switch gears. You know, we'll need either a 15 or a 10 blade to make the incision. If it becomes an open case, you need a bovie, a regular bovie, because it'll bleed. And, you know, like I said, some retractors. So that's shoulder arthroscopy. I will stay here, what time is it, and go through some instruments. We can throw stuff away. I'll tell you what stuff we can throw away. Okay.
For your irrigation, you like epi?
Yeah, when I do shoulder, yeah, epi, don't ask me how much it is. I figured it out years ago, and I told somebody, and they do it. Okay? I think it's like 1 cc per liter. Okay? Of a 1 to 100,000. Is that what it is? Yeah, I still remember. Okay, but it's pretty simple because it comes in you put 3 cc's in a 3 liter bag.
Yep.
Okay. And so we just do that on all the shoulders. You don't do that on these. Okay. How about anything else? Anything else?
Why did we borrow from Summit the other?
There's two different kinds of
Yeah. This is the fast pass, and the other one is a humpback. It has a hump in it so that you can grab tissue that's thicker. Okay. And sometimes if the patient has real thick scarified tendon, this won't work. And so sometimes I need to use the other one.
So we always borrow it from Summit?
Yeah.
I think you do. I think you do because, you know, when I'm down there, if I'm using this one and it doesn't work, we open the other one. Okay, so we can pass the suture. On shoulders, you know, you can have this stuff in the background, but like I said, mostly it's these graspers and tissue tensioners that I use. If I'm going to use any kind of biting forceps, it's going to be the 1.5. So if I got to cut that biceps tendon, I'm going to say, give me the 1.5 up biter, and I'll use that. If I'm going to trim the rotator cuff tendon, usually I'm doing that with a shaver on occasion, I can just use this. So we know what these are for. That's it, guys.
Maybe we can take some pictures of your mouse down the way you want it set up for cases, and then Donna can take a list and Brittany can have